Hello everyone. Today we will be talking about rheumatoid arthritis, or RA, a disease that currently has no cure. However, there is medical treatment to control its symptoms and the progression. So what is RA? Normally, the immune system helps protect the body from infections and diseases. Rheumatoid arthritis is an autoimmune inflammatory disorder in which our own immune system attacks the healthy joint tissues. RA is not the typical wear and tear for the regular arthritis. RA is an inflammatory disease of the joints. RA affects the lining of the joints, causing painful swelling that can eventually result in bone erosion and joint deformity. It also damages the tissue that covers the ends of the bones in a joint. RA often occurs in symmetrical patterns, meaning that if one knee or one hand has it, more than likely the other one will be affected as well. This disease can affect the wrists, the hands, the elbows, the shoulders, the feet, the spine, the knees, and even the jaw joints. In some people, RA can damage a wide variety of body systems, including the skin, the eyes, the lungs, the heart, and the blood vessels. In the image that we are presenting in here, you can see three types of joints. There is the normal joint, the one with rheumatoid arthritis, and one with osteoarthritis, which is the regular wear and tear of the bones. If we look at the middle one, we can see that the synovial membrane has been swollen. This is due to the inflammation. There's also bone loss and eroded cartilage. When this has been going on for a long time, the bones become deformed and they can get fused. And that is why sometimes you may see people, elderly people especially, where they can hardly move their joints because they have been fused. Signs and symptoms for rheumatoid arthritis include joint pain, joint stiffness, feeling unusually tired or having low energy, occasional low-grade fever, and loss of appetite. I would say that the biggest ones will be the joint pain and joint stiffness. So we know what is RA and we know what it does to our bodies. However, doctors still don't know what is the true cause of it. They don't know what causes the immune system to turn against the body's joints and other tissues. It has been established that it could be a mix of genes, environmental factors, and sex hormones that have a part to play in this disease. However, the true cause has not been established, and therefore there's no cure for that yet. Some other risk factors that have been linked to rheumatoid arthritis are having a family history of it, smoking, and overweight. Smoking will particularly increase the risk if you already have a genetic predisposition to develop rheumatoid arthritis. Here are some of the statistics and facts that I found about rheumatoid arthritis within the population. 1% of the world's population has been diagnosed with rheumatoid arthritis. In the US, around 1.3 million adults have been diagnosed with it. That makes up to 0.6 to 1% of our population. Women are also more likely than men to develop RA. And African Americans have a higher risk than Caucasians, Asians, and Hispanics for developing this disease. RA can occur at any age, but most commonly it begins at middle age. Medical treatment for rheumatoid arthritis includes immunosuppressants, physical therapy, occupational therapy, anti-rheumatic drugs, and steroids. About the life expectancy of a patient, rheumatoid arthritis can shorten the lifespan of a patient for about 10 years. However, if they have a medical treatment in place, they are compliant with it, and they have a moderate lifestyle, the lifespan is not different from the general population. which is only an advantage to those who have access to healthcare. What is it like to live with rheumatoid arthritis really depends on how advanced is the disease. For some people can be having lots of medications in your counters, also supplements such as fish oil and turmeric because those do help with the inflammation. Also being active, taking yoga classes, stretching before and after your workouts. But the most important thing is being patient with yourself, taking one day at a time, especially during the winter, because it does tend to hurt a little bit more than the usual. But other than that, here we are. I hope you guys learned something new today, and I leave you my references below. Thanks. Bye-bye.